Federal data is revealing concerning numbers about the state of deadly drug overdoses in San Francisco. ABC 7 Eyewitness News reporter Luz Pena spoke with advocates and city leaders about the plan to tackle the crisis. She's live in the newsroom with more. Luz.
Yes, Emma, the numbers released by the CDC are alarming. Over the last 5 years, about 2 people every day died from a drug overdose in San Francisco. City officials tell us new approaches to this crisis are showing promising results. In 2025, San Francisco's fatal drug overdose numbers surpassed every other county in the country but one, Baltimore. Were you shocked to see the numbers that San Francisco is number 2 right now?
No. Other counties are improving faster than San Francisco is.
So how can San Francisco learn from them?
What I'm hoping is that we have to do everything we can to turn off the magnet and stop being a destination city for drug-related lawlessness.
CDC data revealed that even though San Francisco has the second highest overdose rate for a big city, that total number of overdoses is going down, with 2025 being the lowest number in the last 5 years. We met Steve Adami, executive director of The Way Out, a homeless initiative by the Salvation Army at the city's first abstinence-based shelter. He believes places like this are making a difference.
The program is full. We've had no overdose deaths. We've had no overdoses, an 80% success rate. And I feel like we're opening the right types of programs that help people kind of overcome addiction, overcome homelessness.
The current 58 people in the program have to pass a breathalyzer test when they come in, get checked by security, and have to follow a 9 p.m. curfew, as well as required meetings with on-site managers, creating a drug-free environment.
For years, we were very enabling, that we were approaching the drug and homeless crisis as if it was only a housing crisis, and we weren't really addressing why people are on the streets. I think that's what's changed now.
San Francisco is facing a $643 million budget deficit that could grow to $1 billion over the next 5 years. There's concern this could put financial pressure to services aimed at addressing this crisis.
I am advocating to Mayor Lurie and to my colleagues to make sure that we do everything we can to avoid budget cuts for drug treatment and recovery services.
The city's Department of Public Health said the budget will prioritize the expansion of treatment and capacity. Now, a new strategy the city is also pushing forward is the Reset Center, where law enforcement will take people who are intoxicated on the streets into custody and take them to the center where they will get help instead of jail time. That center is set to open next month. In the newsroom, Luz Pena, ABC 7 Eyewitness News.